I've warmed up the tissue and done some blade work and some flossing, the next thing I did is I rechecked the range of motion. I felt some tightness on the inside and on the outside. Now, I know I have some meniscus stuff going on the inside, so I'm not going to do any of the cupping on the inside. I'm just going to work on the outside here. So I'm going to take some of my RockPods and I'm just going to go along the line that I was working earlier. And we're going to add these along. Now I have lotion on my skin, so I don't need to add lotion, but if you didn't do any massage, you can use a rock rub, and you can just take some of this and put the cup around so you don't have to touch it, so it gets on the outer rim here, and then you can put it on the skin and then press it down. You can pre-plunge and put it down, or you can invert and then put it down. Now that would be your kind of gradient from least suction to the most suction. Now you choose kind of what you can tolerate. And then we're just gonna kind of wiggle. Now, just like I did with the blade to see which direction the tissue is kind of stuck. When I pull this down, I can feel it all the way up the line. When I go out here in this direction, I feel it pulling here. So that's kind of those directions. It's not really wanting to move, which makes sense because when I bend my knee, I am pulling that tissue down and lengthening it. So it's not really wanting to be lengthened right now. So what I'm going to do is just some heel slides here. Now I'm going to try to get a full. So this is kind of the motion that I felt the most restricted on. So this is what I'm going to try to increase. I can also go weight bearing and do some lunges here. And this just gets it's some movement prep. So it's gonna get me ready to go do my workout, ride my bike. I'm not gonna do a ton of squats right now because I do have some inflammation. But if you were doing this and you were feeling good, then this would just be part of your warm up before you went and worked it out with some squats or step ups or some jumps if you're training for something. Okay, so the fun part here is as we take them off, you can kind of see the colors, especially on my pale skin. It's going to show up a little bit more on me. Okay, so now we check my range of motion. That's feeling a lot better. So now I'll show you how to tape it.